Hello, I'm Dr. John Kruse, and today I'm going to be talking about what isn't ADHD. So this is a companion piece to my video about what is ADHD. I do have much more detailed videos about almost all of these subjects that I'm going to talk about today that are not ADHD, but I'm going to launch right into the take-home message. So what isn't ADHD? ADHD isn't trivial. It's not autism, it's not bipolar disorder, it's not depression, it's not anxiety, it's not PTSD, it's not substance abuse, it's not dementia. And when I'm saying it's not any of these things, all of these things can occur with ADHD, except triviality, or maybe that even can occur with it. So we often talk about ruling out, and the official diagnosis requires ruling out all these conditions and any other and physical ailments. But more often in real life, we're talking about yes and rather than ruling out. So you can have bipolar disorder and ADHD. You can have autism. You can have anxious. You can have these things together. And the importance of trying to identify two conditions, if they're both going there, is that it may substantially affect treatment, not just with medications, but with other approaches as well. So that is the take-home message, and I'm going to just launch into the main talk. So again, what ADHD isn't. So ADHD isn't trivial. Lots of people make fun of it as there's a squirrel, someone's distracted, they're late, they're flighty, they're space case. But ADHD, we know, interferes with a whole host of important life conditions. So it shortens lifespan, it reduces the likelihood of finishing education. Not that education should ever be finished, but diminishes the level you might attain, particularly given a specific level of intelligence you might have. So people get derailed in their learning, people get derailed in their jobs, people wind up in prison, incarcerated more often, people wind up single more often, people wind up getting divorced more often. So it has effects on social as well as cognitive and performance-based measures. What else isn't ADHD? So ADHD is one book the title is isn't laziness, isn't craziness, isn't stupidity. If we go to what is ADHD, our current understanding is it's a collection of symptoms related to executive function dysfunction or diminished capacity. And one more thing, ADHD isn't just about attention. So we label it attention deficit disorder. It's not just about attention. It's not even a deficit of attention. It's, if anything, in that realm, it's a deficit of control over attention. So it's harder to have selective attention, choose where you're going to be looking, harder to sustain that attention, and harder to pull yourself out of that attentive state when it's important to switch to another topic. And the other thing when we're talking, so it's not just attention, but it's also not just cognitive. So again, there's lots of focus on how it impairs schoolwork, how it impairs work. And within the DSM criteria, there's no mention of control over emotion, but about 2/3, 3/4, depending which study, of people with ADHD do demonstrate some deficits in control over emotion or emotional dysregulation, among other executive function issues. What else isn't ADHD? It's not created by psychiatry. There have been written reports describing people with these patterns since ages and ages. We go into that one much more. And it's not all about faking. I mean, there are people who exaggerate or even create ADHD symptoms to get accommodations, but ADHD, most people are not faking it, are not pretending, and there's actually some challenges to actually faking it or pretending it. And it's not just a collection of things that everyone else does. I mean, in some ways it is, but to have ADHD, you have to be doing them much more often in multiple contexts to a degree that's impairing you, causing either distress or loss of function. So moving on to the conditions. Condition number one that ADHD isn't is autism. And I'm choosing that first because it's the one with the closest genetic links and the closest developmental overlap. So both of these start early in childhood. They're both considered neurodevelopmental conditions. They are certainly found commonly together. My pet peeve here is that many therapists I've seen address people who have a host of classic ADHD symptoms and tell them that they have autism when they don't seem to have any autism symptoms. So autism for the last few years has been wildly overdiagnosed. It may well have been underdiagnosed before. It is certainly something that occurs on a spectrum. And as I say, I believe in my autism talk here, I think each individual has the right to give themselves the labels that work or fit for them, but by classic definition, there's a triad of symptoms in autism. You have to have deficiencies in social processing, you have to make repetitive, stereotypical movements, and you have to have idiosyncratic, superficial interests. So deficiencies in social processing don't mean just that you're shy or uncomfortable. So awkwardness can mean lots of things. It could mean social anxiety, where you're feeling really anxious with others. It could be tied to ADHD, where you are not paying attention, so you get too close, you miss cues. But certain studies have indicated that people with ADHD, if you point out, it's rude to stand 2 inches away and talk in someone's face, they'll say, oh my God, was I doing that? They are aware of the rules, they know what they are, the rules make sense to them. In contrast, and again, I am going to be using stereotyping but these definitions are there for a purpose. So someone with autism, on the other hand, might say, well, why not? I'm talking, the words are coming out and it's going into your ear. So if I'm 2 inches away, it's easier to talk than if I'm 2 feet away or 17 feet away. At the core of autism is not comprehending, understanding. The social dimension just doesn't make as much sense. So in terms of behaviors, again, many people with autism, by definition, you have to have repetitive flapping, stimming, other behaviors. With ADHD, there can be lots of nervousness, fidgetiness, but there tends to be more variability in what the movement is, more randomness to the movement. And in terms of narrow interests, in autism, they tend to be superficial. So it's someone who goes to the airport and memorizes the serial numbers on the undersides of planes, or memorizes timetables for subway systems, but doesn't even comprehend or have any interest in where actually the different subway lines are going, or doesn't sort of comprehend the meaning or the life relevance of the things that they are focused on a superficial meaning of. So that's, again, a quick and dirty way to try to separate the two. Next item is bipolar disorder. So by definition, bipolar disorder is someone who has episodes of depression and separate episodes of mania or hypomania. Particularly in a manic or a hypomanic state, someone can have high energy, be really scattered in their talk, be emotionally volatile, be distractible, and that can look a lot like ADHD. How do you differentiate? One is the duration of those episodes. So by definition, in bipolar disorder, they are episodes. For hypomania, they have to last at least 4 days at a time. For full-blown mania, they have to last at least 7 days at a time. There are people I've worked with who look like they are manic, but they are manic all the time, pretty close to 24/7 every day of their life. There may be a day that they're down or not, but if you are not having episodes or discrete separate episodes, then it's more likely to be ADHD than to be bipolar disorder. And the other aspect of it is that by definition, part of the mood change is biological, it's endogenous, it's internal, it's not just a reactive response. So many people with ADHD and with some other conditions are very reactive. They're very triggered. If something sad comes up, they may feel sad or agitated for a long time if something angers them. So, but their mood change is triggered as a reaction to something that's going on. By definition, at least some of the mood change in bipolar disorder, and people with bipolar disorder can be hyperreactive, so it gets confusing. The other thing that confuses us also is the term mood swings, which people use very differently. Most people just use it to mean volatile mood. Their mood changes a lot, or they had one or more abrupt episodes of intense mood during the day. That's not what the term usually means technically in bipolar disorder, where it means swinging from a neutral state into a manic state or a depressed state. So it's almost the opposite of how it's used colloquially. One other little, sleep disturbances are common in almost all these conditions, ADHD and the others, but with manic and hypomania, what's classic is someone is sleeping much less than usual, but they are not tired when they are not sleeping. Whereas most people with ADHD, if they get a lousy night's sleep, are really aware that it's slept really poorly, but unless it's so little that they're really wired, they are feeling tired next day. So the other defining criteria is that usually ADHD is developing, used to be requirement before age 5. The requirement was shifted, so it has to be developing symptoms before age 12. But most of the research suggests those people who are qualifying as checking it off by age 12, most of them actually did have symptoms by age 5. If there is someone there recording and making a good record of what's going on, that the age limit was shifted not because ADHD develops later than we thought it was, but because recall for events before age 5 tends to be pretty poor. So it was made, again, not to reflect the underlying condition being different than we thought it was, but the ability to recall that and testify to that. And in contrast, bipolar disorder most often is appearing in late adolescence, very early adulthood, so a delay there. But again, you can have both. Sort of the other half of bipolar disorder is depression, and you can also have unipolar depressions with no aspect of mania or hypomanic episodes. With depression actually can overlap a lot with ADHD. So you can have poor concentration from depression, you can have poor focus, you can have poor inattentiveness, be easily distracted, have low motivation, have low energy. All of those can be ADHD symptoms as well. Again, part of it is that with depression, you are usually, not always, but the most common pattern is episodes of feeling down that last for days, weeks, months at a time, and that usually do resolve with medication or treatment or otherwise. The central criteria for depression, though, is that there has to be a prevailingly negative mood of sadness, and that can also be prevailing numbness, or it can be prevailing irritability. And particularly if it's irritability, that may be harder to differentiate from ADHD. But most people with ADHD who aren't also depressed aren't saying they're feeling sad all the time. They may feel intensely sad at one moment and something very different at a different moment. They may feel numb when they're bored, but that's varying, again, highly with the situation, highly through the course of the day. So again, differentiating depression from ADHD depends a lot on the time course and the intensity and the prevailingness of negative mood. So PTSD. PTSD and ADHD have a strong connection. We know people who have ADHD are more likely to get into physical trauma and emotional trauma, both because they are not as attuned to their environment and may do things that are, and also be impulsive and rambunctious and may even crave excitement and danger. So they're more likely to encounter trauma and to be physically hurt. They are probably also likely to get involved in emotional relationships, which may be intense, or where they're not processing or understanding much of what the other person's trying to do and may get hurt because of that emotionally. Also because they tend to transgress normal social rules. They are more often criticized and emotionally abused by authority figures, parents, teachers, peers as well. So all of these lead to greater trauma. So how to differentiate? So people with PTSD, particularly what is often called complex PTSD, are often scattered. They're often forgetful. They misplace items. They may be emotionally volatile. They may have problems with chronic inattentiveness. So how do you differentiate? One is you need a traumatic situation to cause PTSD. That's part of the definition. And the symptoms need to be following that trauma. If you were this way and then you ran into some trauma at some point in life, if your symptoms precede the trauma, then they can't be all PTSD. So Gabor Maté has written extensively in many of his books and writings. He essentially says ADHD is PTSD, that it's trauma and poor attunement with the mother. Lots of that resonates with many people with ADHD I've worked with, that they feel misunderstood, they feel traumatized, they feel like people in their life didn't meet them where they're at and help them with what was difficult. But it's very clear many people with full-blown robust ADHD do not have any episodes of severe trauma and do not relate to this parental, mostly mother, blaming, creating detachment. So again, PTSD is something distinct from ADHD. It may be at times difficult to separate the two. In terms of other anxiety states, so other social anxiety, other generalized anxiety disorder can also look like ADHD, but the essence of anxiety is there's an underlying state of dread, apprehension, of fear of some future event. Anxiety can make someone distracted, make it hard for them to concentrate, make it hard for them to make decisions, make it hard for them to quiet down or shut off their thoughts. So all of those, again, can look and overlap with ADHD. But the prevailing tone is, if you talk to someone with ADHD, if their thoughts are always bouncing around, at least some portion of their thoughts are probably neutral or interesting or exciting or positive, not just worry, negative, rumination, catastrophe. If it's almost universally negative and worrisome, then you should be thinking of an anxiety disorder instead of ADHD. Again, the two can co-occur. And in my video on anxiety, I at least have one where I think it's useful to consider anxiety as an attention problem, with the problem being you're focused, you're directing all your attention to the wrong thing, to something that hasn't happened yet, may never happen, and may not be that detrimental if it does happen, rather than engaging in what is actually going on at the moment. Next topic condition that can be confused with ADHD is substance abuse. And I'm going to single out just two. There are others that might. So the first one I'm going to single out is marijuana. So there's good research suggesting that people who are using marijuana on a daily basis tend to have a constellation of at least 3 symptoms that overlap with ADHD. They can have problems concentrating and focusing. They can have lower energy. They can have lower motivation. Ways of separating it out are, one is that if it's coming from marijuana and you stop the marijuana, it should get better. Usually, again, with ADHD, there are more symptoms beyond just these 3, this triad, so I'm not going to say too much more. I do have a video on marijuana use and ADHD, and interestingly, there is some research to back up some, and I think it's a small subset, but a real subset of individuals with ADHD do have a positive response to marijuana despite this overlap of symptoms of common responses to chronic use of marijuana and ADHD. The other substance abuse problem that's most often confused with the ADHD itself is stimulant abuse. And that's strange because stimulants themselves are used to treat ADHD, but people who are on crack, on cocaine, abusing prescription stimulants often are revved up They're often talking rapidly. Again, this is particularly people who don't have ADHD, but a big enough dose can push someone with ADHD on too high a dose of stimulants in this direction. Revved up, rapid speech, tangential thoughts, scattered in their thinking, distracted, hyperactive, fidgeting. One tip-off, again, other than the history of this is following ingestion of stimulants, and again, the pattern. So most often, if it's stimulant abuse, there is a brief episode of hours, maybe days, where there is ongoing use, and then periods when someone is crashing for days or weeks at a time or not using and not displaying this behavior. ADHD, there can be some day-to-day fluctuation, but not usually periods of time like that without any ADHD symptomatology. And one big tip-off is dilated pupils. So excitement can dilate your pupils, but that does it for seconds at a time. Stimulants dilate your pupils for many minutes to a few hours at a time. Interestingly, the people who seem to be most often making the confusion or confusing stimulant abuse and ADHD are pharmacists. I really think that's why many of them stigmatize, and this is not meaning all pharmacists behave this way, but almost every patient I've worked with at least occasionally has run into pharmacists, and some chronically, who make them feel guilty, bad for filling their stimulants and sort of treat them as if they are a drug abuser. And again, I think this is pharmacists not knowing enough about ADHD, particularly hyperactive ADHD, and mistaking the signs of ADHD for someone who is already taking too much stimulant. And one other really prominent place where there has been confusion, I think misdiagnosis between stimulant abuse and ADHD is President Donald Trump. I won't go into this in detail because I do have videos about it, but there are many, many people online who say the chaotic behavior, the jumping from topic to topic, the not doing his homework, the being constant movement, speech that is not coherent, meaning one sentence does not follow another. They attribute to his snorting Adderall or using other stimulants. But if you actually, again, look at what's going on with his pupils, when his pupils are dilated, which is an indicator of when he is using stimulants, his speech is actually more organized and coherent. His physical behavior is more restrained and many fewer movements, almost threefold less. So, last major condition I'm going to talk about is confusing dementia and ADHD. And often we think, well, dementia is a problem with memory and ADHD is a problem with attention, and those are two different things. But in the real world, if you aren't paying attention, something doesn't get into your memory very well. So there is actually considerable overlap between dementia symptomatology and ADHD symptomatology. And some of that confusion, there was a paper by Levine et al., a group of Israeli researchers and New York City researchers published a paper in 2023 claiming a 2.77 times greater likelihood of those with ADHD to develop dementia than peers without ADHD. But what they actually did was they only considered people with ADHD who had an onset of ADHD symptoms after the age of 50. So none of these people had classic ADHD, and they acknowledged backwards causation, but it seems, I think what they were really looking at was simply many people developing early stages of dementia. It can look like classic ADHD. You can be forgetful. You can get lost when you're doing things. You can be scattered in your language and scattered in your belongings and distracted and have poor working memory. And again, the biggest tip-off is the time course. And again, that dementia requires a decrement or decrease from someone's baseline and a unilaterally worsening condition. It may be slowly worsening. It may be quickly worsening. ADHD, in terms of severity at its peak, usually by early adulthood, is fairly stable. There may be periods when someone is having less problem with symptoms if they're environment is more attuned to them. But symptoms, at least as far as we can tell now from both clinicians and a limited amount of research, don't tend to be progressively worsening in severity. Two other things I'll just say in passing. I do have a video on sluggish cognitive tempo, more recently called cognitive dissociative symptom. That also is different than ADHD. And I won't belabor that. And I'd also say malingering or faking ADHD. And I do have a video on ADHD is different from ADHD. And again, clearly, the vast majority of people with ADHD are not exaggerating. They're not fabricating their symptoms. These are real. That's it for today about what isn't ADHD. Stay healthy and happy, and there'll be more videos to come.